I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. If you're overwhelmed with medical bills, confused by insurance, your rights, and about getting help, this podcast will be a wonderful education. Eli Rushbanks is an attorney who works at the intersection of medical debt and consumer protection, and he currently is the general counsel and director of policy and advocacy at $4, a patient advocacy nonprofit that helps patients apply for hospital financial assistance. And in that capacity, he works with patients, advocacy groups, lawyers, state and federal regulators, and hospital leaders to improve patient access to and experience with financial assistance. He has helped build $4 from the ground, in which so far has helped relieve over $60 million in debt for nearly 20,000 patients. That is a lot. His work has also been featured in publications such as the New York Times, Wall Street Journal, and NPR. And he reports on charity care. Policies have been cited by the CFPB and also have been the basics for class action lawsuits for charity care violations. So a lot to learn from him. And also Terry Wilcox, she is the Chief Mission Officer with Patient Rising. Patient Rising now is a national nonprofit organization dedicated to advocating for the rights of patients with chronic and life-threatening illness. They work at the community, state, and federal levels to activate patients in support of reforms and legislation aimed at advancing patient access to and affordability of healthcare. So these two wonderful, knowledgeable people are going to give us a lot of information. Welcome to you both. It's great to have you both. And Terry, we'll start with you. If you can kind of tell us what the 340B drug pricing program, what that's all about.
Well, the 340B drug pricing program, it was created in 1992 by Congress to enable hospitals and clinics to purchase drugs at significant discounts to help serve vulnerable patient populations. So it was, specifically enabling hospitals and clinics to do this. The original intent was that the program was intended to support facilities treating underserved communities and helping them stretch their resources to serve more patients.
It doesn't seem like a lot of people or everyone knows about it. Do you think there is big awareness about it by the people who need it?
No, I mean, as I always say to folks, 340B sounds like a tax form. Right? Mm-hmm. It doesn't actually sound like something that patients are going to know about it. And I think that's in some ways by intent. Hospitals like it that way. They don't actually want patients to walk in the hospital and be like, am I part of the 340B program? Am I making you money by, through my medication expense or whatever the case may be? They like it this way. I mean, that's, and to the point of 340B, it's not just a patient-to-patient drug pricing program, meaning it's just to give patients specifically discounts. It's actually to help hospitals who serve a lot of patients from underserved communities, to help them be able to treat more patients in their community, to be able to have more resources available to not only them, their staffing and everything else, but the patients themselves. So it isn't just intended as a direct charity care program, and that's all it is. But it is something that is blended in such a way that it gives everyone pause, because there's many patients out there who are still getting sent to collections.
And that's what I was going to ask Eli. It sounds familiar to what charity care is. And am I correct or am I wrong? Or kind of explain what charity care does.
So charity care as it exists federally It's part of the tax code. It's one of the things that hospitals who are nonprofit hospitals have to have a charity care program. And essentially it's just an amount of money that they have to not collect from low and middle income patients. So usually what a charity care program will look like is a patient who is at or about 200% of the federal poverty level will be entitled to essentially free care to them for all emergency or medically necessary care. This means that the insurance company still has to pay, maybe Medicaid or Medicare still have to pay, but whatever the out-of-pocket cost would be in the form of like a deductible or a copay or the entire bill for an uninsured patient, that's supposed to be forgiven through charity care. And then there's a sliding scale discount that usually goes up to around 400% of the federal poverty level. So this is a lot of people. For a family of four, that's a household income of over $100,000 a year. And at most nonprofit hospitals, they'd be eligible for some form of discount in the neighborhood of maybe like 30 to 60% if they're in that income range. And so these are pretty steep. But what our research has found is that only about 29% of people who are eligible for these discounts actually end up receiving them. So it has similarities with 340B program in that, you know, hospitals are kind of incentivized to not really let people know the full power and the full breadth of these programs, and to really market them like they're supposed to and get it out there. But they operate a little bit differently. This is a discount the hospitals mandated to give, as opposed to maybe like a discount that the hospital's getting.
So a lot of people are kind of confused as to what's a nonprofit hospital and what's a for-profit hospital and what are the benefits for each, because I do think, and myself included, it does get confusing. Like they say they're a nonprofit, but obviously they're making a profit. So it does kind of get confusing for the patient, right?
This really is a question for accountants more than it has like much practical effect in the world. There was a study that came out a few years ago. I think it was led by some folks at Johns Hopkins that found that, at least for the hospitals that they looked at, for-profit hospitals with charity care programs actually might be a little bit more generous with their program. It was very marginal. They were largely the same, but for all intents and purposes, I mean, there isn't a whole lot of difference between a for-profit and a nonprofit hospital.
And my dad used to run a nonprofit Catholic hospital. He was the financial director in Denver. And he used to say, it's a nonprofit hospital, not a no-profit hospital. So, you know.
I use the word tax exempt. I don't say that any of them are nonprofits. There's tax exempt hospitals, and then there's hospitals that are not tax exempt.
And then there's nothing wrong with making a profit at all, of course. And you need good doctors in these hospitals and all of that. But why do you think that only 29% of the people that could be helped it's only such a low number of people, Eli?
There's a lot of burden on the patient, both to learn about these programs and then to get through the application process. We published a report this year that found that about 65% of patients who were highly likely eligible for a discount in a survey that we didn't know about. These were all patients who were highly likely eligible based on income and household size and had received a bill from a hospital that they couldn't afford within the last 12 months. And 65% of those folks said that they had never heard of charity care. They didn't know it existed. That's the single biggest reason for people falling through the cracks. But there were a lot of other pretty shocking statistics that came out. For example, 14% of patients who applied reported that they never got a response from the hospital, one way or the other. The hospital just didn't process their application, or they lost it, or whatever. About a quarter of patients described the process as hard or very hard. There isn't a ton of uniformity in how these programs are run because the law gives the hospitals a lot of leeway, at least the federal law. There's some states that have filled the gaps, but by and large, hospitals get to define how these programs run. So there's hospitals that on what I would call maybe like the good end of the spectrum they might just screen every patient with some automated credit tool without the patient's knowledge, and they're applying charity care fully on the back end. Some hospitals that I know have programs like that are like OHSU in Oregon, MLK Community Health in California. But then there's hospitals that will require a patient to provide a copy of their tax return, their W-2, 3 months of pay stubs, 3 months of bank statements, title to their car, like every little document. And if the patient doesn't provide one of those documents, or the hospital claims that they were untimely, even though they still might be within their application window and providing one of those documents, then they'll deny them. It's a big kind of like messy problem when you get into the weeds of why these programs are failing patients. But the big reasons are patients don't know about them, and the application processes are not particularly easy at most hospitals.
And, I've been in the rare disease community for 29 years now. I had never heard of it.
It's the best kept secret in healthcare.
Yeah, it's very sad. And I was so glad I was on that Patient Rising webinar when I heard about it, because this could impact so many of the people that my foundation works with. And my foundation has been around for 14 years, and I've never been able to tell people about charity care. So I'm really excited about this. But for both of you, I guess, whose responsibility is it? The hospital? Is it a social worker? Whose responsibility is it to let people know about charity care? Maybe not so much about 340B. Maybe that's lawmakers, I'm not sure, but who should be letting patients know, and how can all of us nonprofits, how can we do a better job? I'm going to tell all the other CF nonprofits that I work with about this. Who's responsible, and how do we get more information out?
Eli is going to give a great answer to that, because even though we look at 340B as being a component of funds that should support charity care programs, but that's not all it does. What we want to see from a standpoint for patients to understand is, are you being tagged a 340B patient? What is the definition of a 340B patient? Because patients are coming in and they're not even knowing that they're some of those same patients who are tagged a 340B patient. They've made thousands of dollars for a hospital in some instances, especially if it's a cancer drug, are then the same patients that are going to Eli at $1.04 who are getting a bill from that same hospital that says, they're sending them to collections as much as they can now. I know that's been changed slightly, but they're sending them bills, threatening letters, bills, pay this bill. So that's our track on the 340B front, is to really, it's a complex program. I understand why it hasn't been at the forefront, but it's ballooned to such a way, and it is so big, $66 billion, second largest, drug discount program there is after Medicare, right? Patients should know about it. They should know about it. They should know about this program. They should know about the magnitude of the program. And if they are being tagged as a part of it, that are making, are a part of what's making money for these hospitals. So I'm going to let Eli answer the charity care piece on who's responsible for that. In my opinion, I think it's the hospital, but I'll let him answer.
It's legally the hospital. In 501R, hospitals have an obligation to try to tell their community and their patients about their charity care program. There are pretty strict obligations put on the hospital. They have to have signs in their lobby talking about charity care. They have to put a statement on every bill talking about charity care 30 days before they can send a patient to a debt collector, and they have to send them a plain language summary about their program. And I want to say also an application, but they might not be obligated to do that. But the problem is that even with all of those obligations in place in the law, which sound great, and from what we've seen, the vast majority of hospitals comply with the vast majority of those obligations, at least the statements on the bill and the signs in the lobby. I don't know if I've ever actually seen a hospital that wasn't doing that. 51% of patients in our survey still reported that they had never received any information about charity care from their hospital. And so there is a disconnect in how the messaging is taking place. Charity care is a weird thing. It's not like any other consumer like marketplace concept. I mean, you go to a store, you go to Walmart, you buy something, and there might be like a sale price or like a clearance. They're clearancing some stuff out. Like these are sort of familiar types of discounts. A specific discount for certain classification of care, medically necessary or emergency care, based on your income that you have to prove is like a weird thing. And so when the hospital puts a single sentence on the bill in small font somewhere at the bottom that says, call this 1-800 number if you think you're eligible for financial assistance or charity care or whatever terminology they use, which isn't consistent, it doesn't actually convey what this thing is. And people don't see it, they don't read it, they don't notice it. And if they do, they don't understand it. The hospitals are technically complying with the law, but it's happening in such a way that it's not effectively actually communicating this. If this were truly part of their mission to like maximize charity care as a tool and get this out, they would be communicating about it in a much different way. So they're sort of checking the box, like the compliance box, but they're not actually doing it in a way that they know that it's not successful, and they're not changing anything about their communication methods because they're technically compliant. So they're saying, oh, patients must not want charity care, which is clearly absurd. Who wouldn't want to pay less?
Wow, that's really sad. And I can honestly say, I don't recall ever seeing that sign in a hospital. In all of the doctors my girls have been to, because they both have cystic fibrosis, every appointment, every social worker I've talked to, every doctor, I don't recall anyone ever mentioning charity care to us. Which is interesting. That's 29 years of doctors for 2 kids with a rare disease. So yeah, they're clearly missing all of us. And I also think until you know about it, you sometimes don't see it. So, now that I know about it, of course, I'm going to look for it in hospitals. Are there those signs that I missed before and maybe would see now? And I am reaching out to people and asking people if they've heard of it. And I also think, for the Bonnell Foundation that gives out financial assistance, we only have so much money. So when it gets to a point where it's good to know other places where we can direct people, even HealthWell, which has $25 million for CF patients, they're on and off. Like they're on 1 month, they have no money the next month, and they help a lot of diseases, but they run out of money. So this is really helpful. And I also wonder too, Terry, should people know, or how do people find out which hospitals participate in 340B, or is that a federal program that every hospital is supposed to?
You can look up 340B entities on the HRSA website and other places. I mean, if you can find out if a hospital is a 340B entity or not. Even Pioneer Institute, and I can send you some of these links, has done some amazing work on Project 340B, where they have state one-pagers on the amount of charity care that 340B hospitals in the state provide compared to the amount of, revenue and percentages around 340B hospitals in the state. So they've done quite a bit of work, and they also have a place there that they send you to where you can search like who the 340B entities are in your state. It's always good to know. I mean, I think it's good information to have. Just today, actually, my mother-in-law was in, I shouldn't be smiling about this, but no, I am actually, because she came home. She had a stroke at the beginning of June, and she was in the hospital for a month. And I was really nervous about that bill. I had never seen a bill of after a month in hospital. And, it was, her portion was fairly, I thought, considering she was there a month, to get a bill only for $5,000, I thought was pretty good compared to the other things. But they had, to Eli's point, in there, they had, when I opened it up this morning to take a look, there was a letter in there about charity care. If you can't pay this is the process you go through to apply. There were the steps at the Reston Hospital where we are, which is not a 340B hospital, because I looked it up because I was curious. I digress, but that's, I think patients, they can look it up. But that, to the point, doesn't necessarily mean that there's charity care or not charity care. Every hospital has charity care. And that's an avenue for all patients to ask about.
And Eli, for everybody listening who thinks, oh my gosh, I really need to figure out charity care, what should they do? And again, remind us if these are both based on income or if anybody can use them.
Terry brought up a good point. Just because this is mandated federally for nonprofit hospitals doesn't mean that most for-profit hospitals don't have a charity care program anyways. They're not legally obligated to in most states, but most of them still do have something. So if it's a hospital and you were there for an emergency or a medically necessary issue, there's a very high likelihood that there's a charity care program that someone could take advantage of. So this nonprofit for-profit distinction, even though it's like legally relevant, it's not particularly that relevant for most patients. If patients want to look into this, there's two routes. $4, like our organization, this is what we do. We have a screener all over our website. Like, you can't go to our website without bumping into the screener. And you can fill out a little bit of information, primarily the hospital that you went to, your household size and your household income, and it'll immediately tell you if you're probably eligible for charity care at that hospital or not. If you are, then you have the option to use our resources to apply. So we built a single online intake form that has all of the answers for that intake form mapped to every hospital's policy in the country. And then we have patient advocates that will review all of that, make sure it looks like it's putting the best foot forward to submit a charity care application, and then we'll send it to the hospital for you, because most of the time hospitals require these to be like faxed or paper mailed in. So we'll just go ahead and do that, because that's like removing a barrier. And then our patient advocates will also do regular follow-ups at the hospital and like do all the necessary advocacy work to try to get this thing pushed over the threshold. And that's like something that's totally free to patients. That's one avenue. Anybody can just go to $4.org as long as they know what hospital they went to and get kind of in our pipeline to get help. If people want to go it on their own, we have a bunch of self-help resources on our website as well. But like the starting point is to just hop on the internet and Google the name of the hospital with the keyword like either charity care or financial assistance. At least every nonprofit hospital is required to, but most hospitals have a page on their website that's going to have their policy, their application with information how this works, and that's the best way to get started.
All that information about $4, the links are in our show notes as well as for Patient Rising. So that is there, because people may think it's dollar like the number 4 or FOUR, but it's not. It's $FOR. But those links are in our show notes. This is such important information for patients, and I really cannot believe that myself and so many others don't know about it.
This isn't the first time I've had that reaction. That's why we call it the best kept secret in healthcare.
Yeah, Patients Rising is actually starting a whole campaign called Patients' Right to Know around the 340B campaign, because there's three pillars that we think are really important around what patients should know and have a right to know about the 340B program. The first one revolves around transparency and fairness in their healthcare costs. I mean, we think patients have a right to know if a program is intended to make their healthcare more affordable. If they're receiving care or medication at a facility that benefits from 340B, we think it's only fair that they understand if those savings are being used to make care more affordable, not only for them, but for their community, because that was one of the original intents of the 340B program. And also holding hospitals accountable. The other folks that benefit from the 340B program are like the Ryan White clinics and community centers, and they have no problem putting out quarterly reports that state where their money is going. And hospitals have so far refused to do this. They think that is way too complicated, that it's a too big of an administrative burden. But we think a $66 billion a year program can afford a little bit of administrative burden. I mean, hospitals benefiting from 340B discounts should be accountable to their communities, especially if they claim that they're using those savings to support these underserved patients. When patients are informed, they can ask for accountability, they can push for transparency on how those funds are spent, and they can ensure that hospitals stay true to the program's mission. And advocacy, creating this awareness with the Patient Rights to Know program is the first step for us towards creating that change. Like, it all starts with, patients understanding how 340B works and where it falls short and how they can advocate for reforms to make sure the program benefits patients as it was originally intended.
And I could be confusing this with someone else. You'll correct me, Terry, of course, but wasn't there something about they're getting this money and then they're using it to like rehab other areas of the hospital or use it?
Laura, we don't know, but there's beautiful fountains and artwork and wings of hospitals being built. And a program has ballooned from $4 billion roughly between 2000 and 2009. And once the ACA codified the fact that they could expand, and I won't get into the details of it, they could expand the contract pharmacies and expanded all of that. Now the program has ballooned in such a way that it's off the charts, and it's $66 billion a year, right? It's $4 billion to $66 billion. It's massive. And I'm not sure that the communities where these 340B hospitals are, and I can point to all kinds of stories, are benefiting from all of that. But the wings of the hospitals might be.
It's maddening. And I want to ask you too, because I think of 29 years being in this rare community and learning things and being involved legislatively. It takes a lot of time. And many of these families are just like getting through the day, and they're trying to clean nebulizers and things like that. And our Rare Disease Advisory Council that we're trying to push through in Michigan, it's been 6 years on this bipartisan issue. It might get lost in the lame duck session. It may not go anywhere. We may have to start over in 2025. We have no idea what the new administration is going to bring. Are things going to be worse, better, the same? Who knows? So where do we go? What do we do knowing all the challenges that we face with 340B and charity care and everything else?
I think one of the things that you can always do and focus on from an advocacy perspective, and I believe Eli is probably going to agree with me here on this, is there's a lot you can do at the state level too. There's a lot you can do, and that's what we're working on the 340B Patient Rights to Know campaign in the states. There's a lot of states that are trying to make things even more secretive and be able to expand things more without divulging anymore, right? And so we think that that's not the right direction. And I think, I know $4 is doing some advocacy work at the state level as well.
There's always the states, no matter what's happening at a federal level. I will say though, I am optimistic that regardless of who is in power and how the House shakes out, who's going to have control over the House at a federal level, I am optimistic that there is a pretty good path forward for both charity care and I guess I don't know as much about like the politics surrounding 340B specifically, but just with prescription drug costs in general. These are very bipartisan issues. Mm-hmm. There have been Republican and Democratic senators who have teamed up as recently as, a year ago to push on the IRS to audit hospitals more thoroughly for charity care compliance because they were suspicious that hospitals were essentially receiving more in tax benefits than they were like giving back to the community in exchange for that tax benefit. And did there ever, I mean, we have worked with folks on, across the political spectrum who think that someone who can't afford it, who's low middle income, receiving a huge hospital bill that can push them towards, the debt collection docket or bankruptcy, that shouldn't be a place for that in like our society. This hasn't ever been a political issue. This is more just kind of like a common sense and good practice and fairness and justice and equity issue. So I am hopeful one way or the other. There's going to be an avenue to continue to advocate for, expand these programs and enforce compliance with them.
I'm so glad to hear you say that. It's wonderful to hear, and we're all going to be optimistic. And I think rare disease and chronic illness and cancer and all of that knows no party, right? So, and nobody wants anyone, no one, Democrat or Republican or independent, wants anybody to suffer or have, problems getting help. And Terry, what do you think about kind of moving forward to get information out there and help people?
Well, I feel very similar. I'm very optimistic on the 340B front. Look, no one in patient advocates, we are not advocating for the destruction of the 340B program. It's a vital, important program. It has a ton of money going through it. Let's just make sure that it's reaching the people in the communities that it's intended for, and not hospital wings or salaries or other things. Hospitals should be able to hire more nurses and more support help if they need it to improve health outcomes in their communities, and they should be held accountable for that. Especially with a program with this much money coming through it. So we're very optimistic. Healthcare has always been, I say, it's the purplest thing you can, lobby on possible, because everybody needs their health. And no matter what stripe you're wearing when you go in a voting booth, everybody needs healthcare, and they need it to work. For us, like I said, we're going to be starting our campaign, Patient Rights Know Here, at the end of this year and into next year. Just to really create an awareness around this. And we hope that we can bring folks along at the federal level as well, because obviously that's where a lot of the things within the program sit, because, it was created by Congress. There's also a lot we're going to be trying to state too. And so everything's going to be on our website. We have a website launch called patientrighttoknow.com. So you can go there, and I'll put that link for you so you can put it in the show notes as well.
Absolutely. And thank you both. This was just really the tip of the iceberg. So I encourage everybody to get more information and to check out both Eli and Terry's sites. But before we go, and also I just want to say the Bonnell Foundation is 100% here to help you raise awareness, whatever you need. We'll put it on social media, get things out to our people during our education day programs and things like that. I definitely want to spread the word about charity care that I'm just learning about, and of course 340B. But before we go, Eli, you've got a lot of electric guitars behind you, and I just need to know, do you play those? Are you like a rock star in addition to being an advocate?
I think my Twitter on description says I'm general counsel for $4 and a terrible rock star. So yeah, I play in a few bands, but I've never done anything anyone has ever heard.
Well, those electric guitars are beautiful, and I play the electric flute, but not really since high school. But anyway, so I appreciate your musicality because I love it. So, Terry, do you play any instrument or anything?
I always tell everybody I did major in musical theater from Boston Conservatory, and I have, not a lot of credential in the space that I ended up in my career. Because I actually, but no, I play the piano a little bit and I sing. Those are my skills.
Well, I love that. I love all of our creativity. It's so important in the world, and everything that you two are doing. Thank you so much, because it impacts my cystic fibrosis community and the rare community. and you're just both exceptional. So thank you for doing this podcast with us. I really appreciate it.
Thank you, Laura. We really appreciate it as well.
Thank you.
The original music in this podcast is performed by Kevin Allen,
It's not complicated.
who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.